Good morning, everyone. Today I'm going to talk about something most people really never think about. Even though it affects every visit we make to the doctor, every time we see a doctor, there's a hidden system working in the background. It uses a special kind of medical language to record what's going on with you and what treatments you received. Most people don't realize it, but this language affects insurance approvals, how hospitals get paid, and even certain medical research studies. A lot of people never think about medical coding at all, but honestly, it's a much bigger deal than it seems. Without it, hospitals wouldn't get paid correctly, and the health data we use to track diseases and trends would end up disorganized. So, even though medical coding is behind the scenes, it helps a major role in keeping healthcare running smoothly. My main point today is that medical coding is a major part of healthcare because it turns diagnosing and treatments into universal codes that impact billing, data tracking, and the overall quality of care people receive. So today, I'm going to explain three things. The first, what medical coding is and how it works. The second, why it is important for the healthcare system. And third, how it helps with patients and healthcare workers. Let's start with what medical coding actually is. Medical coding is when a coder takes the diagnosis, treatments, and services a patient receives and converts all of that into a standardized code. Some of the main systems used are ICD-10, CPT, and HCPCS. Instead of writing long explanations, everything becomes a code that means the same thing everywhere. These systems are used in many countries so hospitals, insurance companies, and government health groups can stay consistent with their information. Without these codes, different organizations would struggle to understand each other. Now that we understand the basics of how coding works, let's talk about why it really matters. Medical coding is essential because insurance companies rely on it to process claims. Insurance process claims, right? Without accurate coding, our hospitals wouldn't be reimbursed properly for the services they provide. Coding also helps keep patient records accurate, which reduces mistakes. When different doctors or nurses are involved in a patient's care, accurate coding helps them understand the patient's history quickly and clearly. This leads to a better communication, better overall. But medical coding affects more than just billing or record keeping. Code medical data is used to track diseases, measure how well treatment are working, and help guide public health decisions. For example, health organizations use coding to track flu outbreaks or understand cancer rates. For patients, accurate coding prevents billing errors and makes sure insurance covers the treatment they actually received. Without correct codes, claims might be denied or charged incorrectly. So now let's bring everything together. Today, we talked about why medical coding is and why it is important, how it benefits patients, healthcare providers, and the entire healthcare system. Even though medical coding works behind the scenes, it's one of the main reasons healthcare runs the way it does. So the next time you look at the doctor's note or go into a checkup, remember, there is a whole universal coding system behind your visit. It keeps everything organized, accurate, and functioning the way it's supposed to be. Thank you.